Hello and welcome to COVID Conversations here on WNCU 90.7 FM, streaming on YouTube, Facebook, and Instagram. I'm your host, Kimberley Cartwright, News and Public Affairs Director here at WNCU. And we're using the Zoom platform to talk about how COVID-19 is affecting our world. The guest today is Dr. Delon Canterbury. He's a board certified geriatric pharmacist and the president and chief executive officer of GeritRx, Inc. in Durham, North Carolina. And we'll talk about his involvement in a group called the African American COVID Task Force Plus. Hello, Dr. Canterbury, and welcome to COVID Conversations.
Hey, Kimberly, really appreciate you having me. And again, thank you. Hope you're having a great day.
I'm having a great day, and thanks. I know that you are super, super busy, so I am very grateful that you decided that you would spend a little bit of time with me today.
Of course.
Yes. So first of all, let's talk about you as a pharmacist. So what do you do specifically as a pharmacist?
Yeah, sure. So with my medication management company, GeritRx, we help people get their loved ones off of harmful or unnecessary medications. And we do that not only using our pharmacist expertise, but we also specialize in geriatric care. And so we use genetic testing as a way to screen for any harmful drug interactions before you take a single pill. So that's one of our models. And we've been using this to help people wean off of drugs they don't need, saving them money, building their trust in healthcare, and getting them the best quality results when it comes to their health goals.
So how often does that happen? Do you see people using more than 10 pills or 15 or 20? Is that even possible?
It's unfortunately the norm. A lot of our patients tend to be over medicated, particularly those that are over 65. They have a higher risk of being over medicated. So on average, adults over than 65 are taking between 12 and 18 medications. And of course, the more conditions you have, the more medications you take. So it is fairly common to take quite a good bit of pills when you hit a certain point. But even in younger adults, I think we're a little bit over medicated as well. So you can actually get your own personal pharmacist with my company to literally help you, like on retainer, get to those goals and get off of meds.
Okay. So let's talk now about the African American COVID Task Force Plus.
Yeah.
What is that?
Yeah. So we are a coalition of servant leaders. You know, it's a group of about 6 of us. And it originally started with 2 Duke doctors, Dr. Andrew Flynn and Dr. Roosevelt Campbell, who saw the need for really Black resources, Black vaccination efforts, lobbying to get more of a presence when it comes to COVID testing in the initial rollout of the COVID virus. And so we see that there were gaps in the healthcare system in addressing the needs in our people and our patients. So these 2 doctors saw it when they were looking in the hospitals and the ground forces of Duke. And so it's not Duke centered at all. It's a community facing group. And we just partner with nonprofits, healthcare centers, other church faith-based leaders and groups, as well as community health centers. So we really have a number of local Durham big name community leaders who just keep dispelling more information. And we meet every week on Tuesdays at 12 virtually to give the current updates of where Durham stands during the COVID crisis.
So and then with this collaboration, then what is it that you're finding, and who is it that you're partnering with to disseminate information?
Yeah, great point. So we are using a social media platform as well. We, of course, have several physicians and practitioners that come out of Duke. We also work with other community leaders. For instance, we have people like Wanda Boone, Donald Hughes, War for Life. We have a number of people on the ground. We work with community health workers through Peach, Durham Cancer Institute. So really anyone can join. Anyone participate. We really just want to share information. A lot of it virtually through email and flyers and whatnot, but a lot of it also through social media campaigns and through word of mouth with our partnerships. So that's really been integral in just keeping the bridges, closed when it comes to communication and updates.
So are you guys sponsoring events, any churches or any other kinds of organizations involved when you go out as the task force?
Yeah, we have a number of events. We actually just had one this weekend. It was fantastic. It was at Wheels Fun Park, and we partnered with Latin 19, La Samila, I believe Greenlight, Duke, and it was a job fair we had. So we had jobs for shots. We even had Brian Dawson from K97.5 come down last weekend. And within the first 30 minutes, we had about 55 people vaccinated. So we really are putting the boots to the ground and working as a team with other groups to keep these events going. And we'll have another event at Wheels Fun Park, I believe at August 14th, for a back to school themed vaccination event.
Tell me, doctor, how much misinformation do you encounter when you're talking to people about COVID-19?
Yeah, a lot of the misinformation, what makes it tricky is that there may be a small percentage of truth to it, and it leads to a whole change in what it impacts people's decisions. So frankly, I feel every question I get has a little bit of misinformation. A big one I hear, are there chips in the vaccine? And it's like, no, there's no chips in the vaccine. But I think that came from the box that one of the vaccines was delivered in did have a microchip. And that was because the federal government is tracking where the drugs are at all times, and that's important. So they had microchips, but there was nothing in the vials. As of now, that's not possible, and it's not found in any of the vaccines at all. So that's a bit of misinformation. So I'd say it's every day, it's every part of the battle. But again, it's good to have questions. I'd rather you have questions and ask someone trusted than, go off of that misinformation and make a life-threatening decision potentially.
So then when you're talking to people and they have misinformation, are you changing any minds in your conversations? And I know you said like with your event, people came out and they got the vaccine, but just when you're having like everyday conversations, when people come out on the other side, are they convinced that this vaccine is safe and can be administered safely and then it will save lives?
I think when people finally make that final decision, they start to see the bigger impact of their choice and really accepting that initial discomfort of the unknown and looking at what's in front of our faces. So I would say yes, there are people who, it takes time. We're all creatures of habit, right? But it does take time to get all the information you can and really make that personal choice. I will never ever take away anyone's personal choice on how they feel about getting the vaccine. However, I can change the facts and let you know the facts so you can make the best decision for you. And so I would say, especially now with the uptick in variants for the Delta strain, we're seeing a lot of people kind of second guess their initial response to not get vaccinated, and they're thinking about it now. And we're seeing that it's not just about ourselves; it's really our community, it's our entire world, particularly our Black, Latino, and Native American communities that are favoring worse outcomes in this.
So now that you've mentioned like different communities, are there any myths that are specifically germane to say African Americans? What's the big myth that you hear?
That's a good question. Um, it's funny how the different phases of this rollout have led to different types of questions I would get. So first it was, I don't want to be a guinea pig, right? So it was the Tuskegee stuff, a little bit of that, but it wasn't everyone's idea. But that was in the beginning. Now that we have it out, the most common things are here are from the young adults who are, invincible, and I have a healthy immune system, so I can just keep doing what I'm doing and I'll be fine. And the problem is the game has changed. And if the virus is spreading, twice as much than the original strain, if not more. And so people just think, well, since I've been fine all along, I ain't gonna get it. So I'm just gonna continue doing what I do. And a lot of that I see is from our younger adults. Our younger Black populations tend to be a little more resistant, I see, in getting vaccinated. And a lot of it's just that feeling of I'm invincible. But some of it's just, again, they have questions, and not everyone quite understands how viruses really spread. And when you start seeing that, and you have measures that are protective and can, prevent what we're seeing in other countries, it's easy to say, hey, look, here's this country and here's ours. They don't have vaccines and we do. When you start putting things in easy to understand terms, people tend to have a second thought. But I will say that everyone's on a spectrum of vaccine concerns, right? You got a very small few that are just, I'm never getting a vaccine, point blank, period. Most people just fall in the middle, and they just have some questions that got to be addressed. So you have to make sure you open a space that's non-judgmental for people to express their fears and concerns.
So what about the history of vaccines? When I was little, going to the first grade, there was the smallpox vaccine. And I think everybody who was in that generation has like remnants of getting that shot from the spot on the arm. Mm-hmm. So when you talk to people about vaccines, are we not in a country that has a history of people getting vaccines to fight various diseases?
Yeah, man. We've historically had, believe it or not, vaccine campaigns in the late 1800s, even dating back to England. But with that same token, we've had anti-vaxxer campaigns since the beginning of time. Like, this whole talk is human nature, but really, yes. And the reason why we're still alive is because we have vaccines. Just the World Health Organization states that the implementation of vaccines yearly saves about 5 million people. 5 million people. And guess what? We've lost 4.4 million people to COVID. So that's just on a year. That's just for all diseases. And so this is a part of our evolution as human beings, is to get better with technology and increase longevity with preventable diseases. And smallpox had a fairly high mortality rate when it came out. So that's why, everyone just got it. But there are reasons why we're not talking about smallpox anymore, right? There are reasons why we're not really talking about measles. And it's because of vaccinations. They have shown time and time and time again that they do work. So yeah, vaccines have been here forever, and they'll always be here since there'll always be a virus trying to outsmart our vaccine.
So talk about that for me for just a second. So what does it mean when scientists talk about like mutations of the virus? So first it was like COVID-19, and now the whole thing, the whole like campaigns are built around getting people to get vaccinated because of the Delta variant. So talk about that for me. What does it mean when scientists talk about the mutation of viruses?
Yeah, so the only goal a virus has is to live, straight up. It needs a host to live. It could be an animal or a person. And each time it gets into a person, every time it tries to, spread and grow in the body, it has to copy itself. And so sometimes when the virus tries to copy itself, it's a little sloppy. It's like rush. It's like, I'm going to turn my paper in late. Like, it just kind of rushes through. And when it rushes through, it gives room for error, and it doesn't do it as perfectly as, say, the beginning wild type strain of the coronavirus. So as time goes on and person to person spreads, we're giving room for the virus to keep changing every time it copies itself. And so when it jumps from me to you to someone else that you flew on a flight with, it's done changing a couple of times. A lot of times the mutations are actually bad for the virus, and it tends to die out and it no longer exists because it sucked as a virus. Sometimes it does well. It mutates to get better because it always wants to get better. And so we're not talking about like a superpower, but basically it's a change in the code that was copying itself. that led to it maybe jumping from person to person a little better, or sticking more to the cells to infect into the host. So basically, it's just the more time we give a virus to copy itself and change from person to person to person, that leads to mutations, which are expected and completely natural in this realm of disease control. So this is a normal part of the process. But sometimes, as you can see, the mutations lead to stronger ways of evading our body's immune response to fight it off. Or it can find ways to hide and sneak or get better at being less detected. And that's what some of these mutations can cause. It doesn't always mean it's completely harmful or more deadly. It just means the virus is doing what it's supposed to do, which is trying to get better at living and living longer. And so with more time away from being vaccinated, we're giving more room for the virus to change. And guess what? There's going to be another strain. There's going to always be another strain. There'll always be a delta, eta, theta. We can go through all the Greek letters, right? It's going to keep doing that. Whether it'll be, a variant of concern is another question.
So we have come completely to the end, but I've just got one more question. If you could answer quickly for me. How long will the vaccine last? Okay, I went and got my vaccine, and I'm concerned about how long I'll be protected.
That's a good question. We honestly don't know right now. We have studies that say it definitely lasts at least 6 months. We have some newer studies that are saying that we're seeing that it's a little bit longer than that. We just don't know yet, honestly. And that's why I feel I appreciate the jumping on the ball on getting some boosters made. However, the vaccines work very well. I mean, they work very well. And there are some pockets of people that, you're not going to get that same lasting effect. Like, for instance, if you're immunocompromised or, 70 and up with all types of chronic health conditions, or you don't have a liver, things like that, it's likely to not last as long as most people. But for most people, from what we can say, at least 6 months, but we still have yet to see how long they'll last. And I'm going to be honest with you, we're not going to have yearly boosters. It's unlikely to be the case for that. We're going to probably have maybe 5 or 10 year boosters. But that's my opinion. We don't know for sure, but I wish.
Okay. Then lastly, best suggestions for how to avoid coronavirus.
Hey, we're talking about the same stuff. The 3 W's: wash your hands, wear a mask, and wait 6 feet. Just avoiding those crowded places. Definitely wear your mask indoors, as the CDC is saying now, regardless of vaccination. And, social distance. I know we're tired of it, but it's not over. We have a ways to go.
Okay. Thank you, Dr. Delon Canterbury, for being my guest today.
Absolutely. It's my pleasure.
Yes. And we want to thank you guys for listening to COVID Conversations. We want to thank you for following us on Facebook, on Twitter, and on Instagram. And we want you to definitely go to our website and check out our archived shows. I'm Kimberley Pierce Cartwright, News and Public Affairs Director here at WNCU. And thank you again for listening to COVID Conversations.